right, welcome back. Dr. Palik is talking about high blood pressure and stroke. So can we talk about if ethnicity kind of factors in, if some ethnic groups are more at risk for high blood pressure than others?
That's right. We see in the African American population, even Hispanic population, an increased risk of stroke. In the African American population, about 4 times is likely to have a stroke, and at a younger age, unfortunately, which is something to keep in mind and make it a priority to have your blood pressure and modify those risk factors.
Okay, high blood pressure leads to stroke, so let's talk about the risk factors of stroke. Is it just high blood pressure or are there other things?
So high blood pressure is probably one of the leading causes of stroke. Other causes are high cholesterol, so we want to get your cholesterol in check and get on a medication if we need to. Certainly, you can modify it through diet as much as possible. Smoking is a risk factor, so that is something that is modifiable as well. Obesity, and this is also linked to high blood pressure. Obesity and high blood pressure go hand in hand. So dropping 10 pounds in your weight can lead to a 5 to 10 point drop in your blood pressure. So they're definitely linked. And so these are things that can increase your risk of stroke.
All right, well, some people I think of strokes as only happening to the older population, but that is not necessarily true. Let's talk about that a little bit.
That's right. The risk of stroke goes up after age 55, but we're seeing, unfortunately, more and more younger people coming in with strokes in their 40s and even in their 30s. Just recently, I saw someone in their 30s, and they had, unfortunately, uncontrolled high blood pressure, and she was an African American female, and she was just struggling to get her blood pressure under control, and it's been that way for years, and she had her first stroke, unfortunately.
Yeah, that is so scary to think that it could happen that young. What are the signs of a stroke that all of us need to be aware of?
Yes, so the acronym we love to use is B FAST, and B is for balance. So you want to look for things like inability to walk, being off balance, maybe trouble with coordination. E is for eyes, so loss of vision on one eye, both eyes, or maybe even double vision. F is for face, so a facial droop. If someone has a crooked smile, that's something you want to be on the lookout for. A is an arm or leg weakness or numbness, and typically it's on one side. S is for speech. So things with speeches, people will typically describe someone that has a garbled speech or a word salad, but basically inability to get your words out and for people to understand what they're saying. And the last is time. Call 911. As soon as you notice these symptoms, call 911, get that person to the ER. Time is brain. We lose millions of neurons per minute. So the faster you get to the ER, the better. We have a lot of treatments, and if you get there quick enough, we can give you a powerful blood thinner or clot busting medication, which can help you fight the stroke.
I think some people are like, when something like that happens, I mean, they're just taken off guard, right? That something weird is happening and they want their loved one to be okay. And so sometimes they want to see if it just gets better.
That's right. And don't wait. Even if the symptoms do get better, don't wait. Go to the ER, because sometimes it can get better, then it can get worse again. So as soon as you notice the symptoms, call 911, go to the ER. Do not drive yourself, because the symptoms can get worse, and you don't want that as you're driving. And the other thing is, do not take an aspirin. There's 2 different types of stroke. So best thing, call 911, go to the ER.
Do not take an aspirin. Yeah, and that's something that's a myth that people have been talking about a lot.
That's right. I think they think of having a heart
Heart
attack
attack.
and taking an aspirin. I think they associate the two.
Okay, what steps can we take to help reduce our risk of stroke?
So the same modifiable risk factors for high blood pressure, things like quitting smoking. We have a more than twice the increased risk of stroke with tobacco use, so that's something that's modifiable. Obesity, losing weight. I think I mentioned losing about 10 pounds. You can decrease your blood pressure about 5 to 10 points. Healthy lifestyle in terms of diet, low fat, high fruit, vegetable diet will help cutting down your sodium. and avoiding excessive alcohol use, which can weaken the blood vessel over time.
Okay, great. Thank you for all of that. You know, that was really the interesting thing when you said about the sodium in sodas. I always look at the sugar of it and the caffeine of it. I never thought about the sodium of it. So thank you for your time and your expertise. We appreciate it. Thank you so much for joining us as well. If you missed any of this, maybe you need to send this to a spouse or a family member or a loved one, this is going to be in the To Your Well-Being section.